Excellencies here present, members of the private sector, and in particular the president of the Dangote Foundation. We miss you in Addis, but we felt the impact. Members of the diplomatic corps, the Nigerian officials who have made this possible, and all other colleagues, stakeholders, they are present. I thought it's important for us to give you a brief idea of what the AU has been doing since the onset of the Ebola crisis. I've always said it is very difficult to define what a timely, adequate, and appropriate response can be for the Ebola outbreak. But of course, our brothers in Nigeria have answered that question. The approach they used was timely, it was adequate, and it was appropriate, and we all know what the result is. But from the African Union point of view, we have been quite active, and our activities on the Ebola crisis started from April 2014. And at that time, we all know what the level of the epidemic was, but we came up at a joint meeting of the African Ministers of Health that was held by the African Union and WHO. And in that meeting, two important activities were made that were very relevant at the time. And one was a very strong communique to all the member states. And then the second was we asked all member states who had some experience in handling Ebola issues to assist their brothers, the three countries at the time. And the response was quite appropriate. We had countries like Uganda, DRC Congo, Benin, and quite a few others that went under the umbrella of the WHO and made their contributions to the countries affected. Now, this was followed in June, July by a lot of advocacy activities in the African Union. And in particular, we put together, or we consulted our emergency funds. You know, we had the emergency fund for drought and famine, which because of the emergency, we added Ebola onto it. And we also had our emergency assistance fund for humanitarian, for refugees and internally displaced people. But this was a fundraising activity that was not only symbolic at the time, but it was appropriate at that period. We raised the first $1 million, from member states that went to the states that were affected. But then, at this time, the international community had geared up, and it was a time when the Peace and Security Department of the African Union invoked their Article 6, which looked at the humanitarian aspects, and they commissioned the military and civilian group of the ASOA, the results of which you are seeing today. Following this, the next activity that took place was the Emergency Executive Council meeting, which was actually meant to send the message home to member states. And what that meeting looked at was the issue of stigmatization, and I'm sorry to say, with all the effort, there is still a lot of stigmatization going around, and we're hoping that this should be taken care of as soon as possible. And secondly, that meeting also addressed the issue of airline closures, border closures, and the fact that the countries that were affected, most of the airlines that were serving those countries were completely withdrawn. And the third aspect that was looked at by that meeting was now looking at the post-Ebola issue. And the issue of an African Center for Disease Control was entertained, and it was said that it should be fast-tracked. Now, stepping back a little bit, the Peace and Security Council commissioned what we now know as ASEOA. And I'm sure all of you know what has happened. It has been muted in most of the people who spoke here this afternoon. It's a military civilian component of medical staff, and we have now deployed in all the three countries. Our original idea was to rotate 100, 200 officials throughout for something like 6 months. But as you can see, the goodwill of Africa, the goodwill, the brothership shown by Africans has taken this a step further. Now we're talking about deploying 1,000 people by the end of the year. We are the head of mission, a very impressive gentleman who took care of business in the 3 countries. And the interesting thing about this head of mission is that he has seen epidemics of Ebola, 3 of them, and controlled them in Uganda. So we thank him in his absence here. Then part of ASEOA was sending assessment missions to the 3 countries. And this was done on the 25th and 5th of September this year. These missions went to the 3 countries, assessed the gaps, the needs, and whatever it is the countries that needed. And we worked directly with the countries before the deployment took place. Now, the deployment is usually, we do a lot of training because we think that it is very important, before these volunteers who are so important to the project and whose activities we appreciate so much, we wanted to ensure their safety. The first deployment was on the 18th of September in Liberia. 33 medical personnel were deployed. In Sierra Leone, it was on the 10th of October, again 33 were deployed, and Guinea was on the 4th of November. We are up to 23 people there. Then following this, the chairperson of the African Union, Madam Dr. Nkosazana Dlamini Zuma, accompanied by the Executive Secretary of the United Nations Economic Commission for Africa and the President of the African Development Bank, also made their rounds in the 3 countries, engaged with the heads of states, spoke to our teams. They gave all the encouragement that was required for the volunteers that we had out there, and they also had a first-hand impression of what was going on and what was required. And it was following this that a lot of activities actually started taking place in the African Union. And the most notable of these ones was a visit by the United Nations Secretary General, Ban Ki-moon, President of the World Bank. And this together met with the chairperson in Addis Ababa on the 28th of October. And this was actually the time when the response in the international community really geared up. Because at that time, UNMIR was already on board, and we were given a lot of assurances of assistance from the African Union point of view. Then the last activity, which we are very proud of, was the roundtable. The roundtable by Africa's businessmen who met at the time, and they decided to take care of business in Africa. And we all know the result of that. We were able to raise, you heard what the chairperson had enumerated, but we went pretty close to over $30 million at that time. And this just tells you, what Africa can do when it really puts its act together. Then after that, in a meeting that we had during the WHO meeting in Benin, in Cotonou, we also had a brief meeting of ministers of health from the medical staff contributing countries. And in that meeting, we tried to harmonize the conditions, harmonize the procedure that we are going to use in terms of sending these volunteers abroad. So at this point, I would only thank the people who have volunteered, thank the Nigerian team, and I'm sure they are going to be very, very useful out there on the ground because they've seen it before. They will know exactly what to do, and we hope that by the end of 2014, we'll be able to come through with our target of 1,000 medical health workers on the ground in Sierra Leone, Guinea, and Liberia. And as I'm talking, we have Ethiopia on the pipeline, DRC, Kenya, Burundi, and some East Africans already on the pipeline also to send volunteers to the 3 countries. So with this update, I thank you very much.